Like I said, we're working with Ministry of Health, our partners, and they're giving us guidance in this particular area. But the campaign is addressing, in general, behaviors amongst pregnant mothers during the time when they're pregnant, during childbirth, and post-childbirth. How they care for themselves and how they care for their babies. And there are a lot of underlying behaviors in there. Behaviors like, do you go to the healthcare center for your ANC visits? Do you give birth at home or do you give birth at the healthcare center? How do you breastfeed your baby? Do you breastfeed your baby as recommended by the Ministry of Health or your health worker? How do you look after the baby when the baby is born? How do you take care of the cord? How do you handle the baby when the baby is sick? How do you ensure that the baby does not have infections? So there are a lot of underlying behaviors in there. Nutrition, yes, is just one of them. But as you appreciate, there's a lot of messaging in there that we have been advised by the Ministry of Health that it is a lot better and it bodes well for public consumption if we address each issue on its own. So there is an overall sort of umbrella that is being addressed when it comes to change in behavior. And the change in behavior we're addressing also overall in the campaign is not just by the mother or the primary caregiver. It's also by the people that influence her behavior and her ability to actually practice the behaviors that are being recommended. One is her husband, two is her mother and her mother-in-law, three is her immediate community, her neighbors, her church leaders, her friends, and three are the other influencing factors, the media, the government, the health system, the healthcare system. So she gets messaging from all these people, advice on how she should behave and how she should look after herself and her baby. So the campaign is addressing communication to all these stakeholders, including the primary caregiver, who we are trying to empower with respect to the knowledge as to how she's supposed to care for herself and her baby, to ensure that they do survive and they survive and are healthy.
A few highlights about the problems in nutrition, particularly the children that are under 5. The newborns are also children under 5 years. For example, children who are under 5, about 33 of them are short, stunted. That is unacceptable. People should attain the height that is acceptable, that they should have. So to have 33% of the population of children under 5 stunted currently, it's unacceptable. So we have to do something about it. And also children still under 5 that underweight are about 14%. Yeah? So again, that is acceptable by the standards of a healthy population. Underweight means they are small for their age. It's unacceptable. So we have to do something about it so that they attain good weight for their age. And those that are wasted, meaning that they are small, the weight for their height is unacceptable. It's about 6%. Again, that is too much. It's unacceptable. By standards in a healthy population, the acceptable ranges should be below 5. So we still have a long way to go. And for example, anemia or iron deficiency, it's a very big threat. 49% of these children who are under 5 years have some degree of anemia. So that means if they get any slight illness that reduces even their blood further, puts them at risk of dying. So we see majority of our children dying because of these preventable causes. And these are the most recent surveys that were done by the Uganda Demographic Health Survey. Although there is some improvement from previously, for example, from 2006 till now, but still we have a long way to go. Like Barbara had said, not Barbara, Hilda had said that 50% of the deaths of children are linked to malnutrition. Why should that be? Half of the children are dying because there is malnutrition. That's too much. If you have 100 children and 50 of them are dying because links to malnutrition, that is unacceptable. And they are dying because malnutrition puts them into vulnerable conditions. They get common diseases that can be prevented. For example, diarrhea, or they get pneumonia, or they get TB just because they are malnourished, their immune system is poor. So we can do something about it. Together we can put our heads together, our hands together, our resources together, and reduce these deaths of children that are preventable. I work in Mwanamujimu nutritional unit in Mulago currently, but you look at what predisposes these children to malnutrition, the need for admission, and they are preventable, but it's because there's little awareness in the masses, but also maybe we have to work with our partners, like in government. Policies need to be changed so that we put a lot of emphasis in the nutrition aspect of pregnant women and these children. It starts with a pregnant woman. If this pregnant woman is not well fed, the outcome of this baby will also be poor. A malnourished pregnant woman is most likely to give birth to a malnourished baby or small baby, and this baby is at risk of dying. Even if it doesn't die, the growth will be poor, then they might also be vulnerable to these diseases and might actually eventually die. So if we start with the pregnant women and then we trickle it to follow up the born babies so that they attain adequate nutrition, that would be a great thing. So advocacy, and remember, children may not have a very strong voice. We have to work with them to advocate for the nutrition of these children and the pregnant women.
Can I tell you, this is the biggest problem we have in the United States now. We have an epidemic of childhood obesity and junk food, and to the point that the president's wife, Mrs. Obama, the first lady, this is her big campaign, is to try. We have the opposite problem that you have in Uganda, but it is malnutrition. Just as she said, it is malnutrition, but the opposite problem. So I think, and I've only been in Uganda 1 month, so I'm no expert, but I see what you have in your supermarkets. I see your fast food. I see Uganda is going to start developing some of the problems, some of the opposite problems, some of the same problems that we have. They call it the curse of development. Right? Yeah. There's too much. It's too cheap. It's easy for the kids. They want the candy, the sugar, the junk food, the fast food. So that will be your next problem, truthfully, going forward after you solve the undernutrition, which I think you will, because Uganda has made great strides. And I think everyone working together, you can solve this problem. But I'm worried in the future you might have the other problem.